In February of 2014, I got pneumonia. During recovery of that, I started noticing some shortness of breath, and went to my cardiologist at Prairie Heart in Springfield, Illinois then, and realized from him that the valve was sticking open at that time and was going to need replaced. He had referred me to Barnes-Jewish Hospital and Dr. Zajarias and Dr. Maniar.
Mr. Foster was a bit of an unusual patient for us to meet off the bat. He was a bit younger than the average patient that's referred for transcatheter valve replacement.
He unfortunately was born with an abnormal heart valve and had a heart surgery when he was very young, and then had a redo heart surgery with a valve replacement and a root replacement also in the recent past.
He explained to me it was serious because the valve had calcified to the point that it was too risky to try to remove. It was too risky because of too much of a chance of a stroke.
We were posed with a very special problem with him because he wasn't a surgical candidate. As a result, he was falling into an area of clinical research which is called valve-in-valve procedures. These procedures were only available, or are still only available, in a research trial, but unfortunately the size of his valve, the size of the valve that he would require, was too large for us to enroll him in the clinical trial. We knew that we had the technology that was available, we had the expertise of how to treat him, and then we basically had to ask for the green light from the FDA to allow us to treat him with the technology that was available.
If you're short-winded, it means that you feel like you can't get your air. That perception is very disabling to people.
I asked Dr. Zajarias what specifically size heart valve I needed to request for, because I decided to call our congressmen and representatives and ask them to contact the FDA on Dyke's behalf. Dr. Zajarias came in about 8 o'clock that evening and he said, "Rumor has it there's a valve on the way." So that was really good news, and I know it wasn't just the fact that our senator had acted on our behalf. I know that the doctors down here and the board of directors and all the people down at Barnes-Jewish had really been working hard all day long on his behalf too.
When I first got here, I was very, very scared, and they were very, very confident, which was awesome to me.
So catheter valve replacement is the procedure in which we replace the aortic valve through a catheter system. We basically mount a valve in the tip of a catheter-based delivery system that could be inserted through the leg, through the tip of the heart, or through the ascending aorta. After doing some careful positioning, both with ultrasound and with X-ray, we're able to replace the valve with a new valve that is mounted inside a stent or a frame that we actually expand in the appropriate position.
Typically, I would tell the average 80-year-old or 90-year-old, where some of these procedures are offered, that this is going to take them 7 days in the hospital and perhaps 4 to 6 weeks to really recover well at home. In Mr. Foster's case, he spent the 4 to 7 days in the hospital and was probably feeling pretty good at about 2 or 3 weeks.
In his words, I think he's 100% back to normal and is able to complete his mail route without stopping, and is just as energetic today as what he was maybe 10 or 15 years ago.
I always heard stories of how wonderful Barnes-Jewish Hospital was, and until you have to, unfortunately, experience the care that you receive down here, you just really can't grasp how awesome and amazing the miracles that they work down here are.